Non-weight bearing. So when you're non-weight bearing, that means your foot is not touching the ground at all. So when you use the crutches, they step in front of you and then you make a little hop with the healthy leg. You can make the hop easy and small until the height of the crutches, like this. Or you can make it bigger and walk all the way through, kind of like a swing. Tiptoe weight bearing. This means only your tip of the toe or sometimes the whole foot can touch the ground without putting any weight on it, which is a rather difficult way to use for weight bearing because you kind of feel like you have your foot on the ground and you can use it, but this only helps you to balance a little bit, not to put weight on it. This means you move forward with the crutches, have your foot at the height of the crutches, and either again step at the height of the crutches, so like this, or you can go ahead and walk through with the other leg. So the crutches go in front, the tiptoe of the injured leg is in front with the tips of the toe. You're not weight bearing on that foot, and then you walk through with the other leg. Partial weight bearing. So for the partial weight bearing, it means that you use your crutches in front of you. You step with the partial weight bearing leg first, and then you can either step at the same height, doing a 3-point partial weight bearing at same height, then continue moving forward using the partial weight bearing leg, and then follow with the other leg. This would mean that when you step the partial weight bearing leg in front, that you only use the allowed partial weight on that foot. So even if I'm here, I'm using more weight on the crutches than actually on the foot. So if I stand fully, I could not use the crutches, but with the crutches, obviously, I'm trying to take off the weight of my foot. So you can either do that in a, like I said, in the 3-point position, or you can walk more regularly. This means you would step forward, step with the partial weight that is allowed. We will talk about that in a minute. And then move forward on the other leg with the full weight. Then move the crutches forward again, partial weight, and then move forward. So it looks as if you would walk more normal even if you don't. Now, to make it easier and to get a feel of how much weight you're actually using, you can use a scale. So basically, you step next to the scale with your crutches, put your foot on the scale, and then slightly put the weight on the partial weight bearing leg. And you will see even 50% of your weight. So in some cases, this will be when you divide the 60 kilo divided by 2, it's going to be like 30 kilos. Is not that much weight. So you put it on there until the point, and then you know, okay, for the next weeks or the next days, whatever you agreed on with your doctor, this is the weight you will use. So you can try it a couple of times to see how it feels, because when you walk, you will not have the scale. And this is how you can kind of check and control how much weight you put on your foot. 4-point full weight bearing. With the 4-point full weight bearing on crutches, this means not both crutches are in front of you like the 3-point, where you have the 2 crutches and one leg is swinging through, or you have the 2 crutches and walk through. But for the 4-point, the crutches move with the opposite sides of your feet. So when the right foot is in front, the left crutch and arm is in front, and vice versa. This is only to support you while walking more safely if you're still supposed to use the crutches, and get rid of them slowly.